Hello to everybody. I come from Italy and I work for a regional administration in a northern region of Italy, that is Pimonte. And there we have made an interesting project about humanization of hospital. English is not my language, so I am sorry, but I try. Okay. But I'm grateful to be here for this invitation, which allow me to share with you this beautiful experience we have made in Piedmont, in all Italy. To represent better, I read something about this experience. The cardinal principle on which the Italian health system is based is the principle of the centrality of the person. The principle of the centrality of the person is an essential element from which care facilities can maintain the needs of clinical assistance of persons strongly linked to the human needs to respect their integrity and dignity. Humanization, understood as a method to make care facilities as person-oriented as possible, is an essential element to guarantee the quality of the assistance. The objective of humanization assistance in Italy is set out in the health pacts, which provide that the region undertake to implement humanization actions on the structural, organizational, and relational aspect of assistance.
Mirella, can I ask you to slow down a little bit? I'm terribly sorry, but since English is not our main language for any of us, if you could slow it down a little bit, we would be able to understand better.
Anche in italiano così.
In particular, the legislation provides for the adoption in all structures of the national health system of indicators as a standard method of verifying the quality of health services with the reference to the personalization and humanization of assistance and the right to information. But which our concept of immunization and what concretely we have made. Since 2011, the national agency has implemented a program, a program for the continuous improvement of the degree of immunization of hospital. The program has defined a method for periodic evaluation of the degree of humanization of public and private hospitals. In the program, specific indicators were identified and adapted to measure the degree of humanization of hospital. The indicators were developed from the experience of civic audit and are based on the principle of people-centeredness, continuous quality improvement, and empowerment. The national agency checklist, whose structure is illustrated in the slide, contains 142 items divided into 4 areas, 12 sub-areas, and 29 criteria. The 4 areas analyzed are medical assistance and organizational model, accessibility and comfort of the care facility, access to information and simplification, and management of the relationship. The checklist records the phenomena considered indicative of humanization based on the analysis of different national and international information sources. The indicator identified represent a wealth of information available to the health system. The evaluation was carried out by all regions of Italy in a participatory way with the citizen according to the empowerment model. Altra slide. For the first time, citizens and health professionals discuss hospital issue together and actively participate in the construction of the evaluation instrument and in the formulation of proposals for improvement. This was a very important moment because, on the one hand, citizens entering the hospital organization and learn about the complexity of the system. On the other hand, the professionals encountered problems that they were underestimating. The participatory evaluation and improvement tools were initially developed in hospital and have been used to evaluate more than 400 public and private hospitals throughout the country. The Piedmont region has been involved in the program since the beginning. The program foresees the health professionals and citizens participate together in all phases of the evaluation and improvement process, from the construction of the checklist to the evaluation, to the analysis of the problem encountered, to the definition and implementation of the improvement action necessary to overcome the problems encountered. During the site visit, local mixed team of health professional and citizen volunteer provided a common response to each of the 142 checklist items. In total, in Piedmont region, 35 hospitals were evaluated, all public hospitals with more than 120 beds, and 23 voluntary associations and 80 citizens participated to the program. Each hospital has drawn up an improvement plan in relation to the problems encountered, the implementation on which will take place in the coming months, and implementation is subject to regional monitoring. The main problems were found in the areas of accessibility to services, transparency, and relationship between the health professional and the patient, in particular about the presence of physical and sensory barriers, possibility of access for family of patients, free access internet, television inside the bedroom, informatization, possibility to consult online or to have at home clinical documentation, more training for professionals. It is therefore on this problem that the hospital's improvement action have been focused. The experience was then applied also to territorial health, with particular attention to the participatory evaluation of the humanization of assistance to the elderly and frail. The program has also been enriched with participatory patient safety assessment tools. What were the objectives achieved? The aim of the program was to improve the quality of health services. First of all, the program made it possible to set up a network of professionals in the various hospitals concerned by this problem and to develop in the following years method and instrument for evaluation and improving the quality of care built in consultation with the various players. In Piedmont, from 2015 onwards, humanization has become a management, health, and operational objective of the service assigned annually to the directors. A regional coordination on humanization has been established, defining a structured model of improving the quality of health service. At the regional coordination participates the Patient Tribunal, which is the most important association for patients' protection in Italy. The improvement action implemented by the hospital between the first and the second survey have made it possible to correct the problem identified as far as possible by improving the score odds. This is demonstrated by the graph, the first of which represents improvement implemented by each hospital from the first to the second survey, and the second graph, the overall improvement referred to the most critical elements. In conclusion, the work of recent years, really in the last year works was in part suspended for COVID, has confirmed that the humanization of assistance brings great added value both in the relationship between health professional and patient and more generally in improving the quality of assistance. And improvement of human relation has a significant impact on the perceiving quality of the assistance offered, on the reduction of conflicts, and therefore also on the reduction of dispute in this area. Humanization must therefore be seen as an indispensable system for improving the assistance process.